Well, the Edna Adan hospital took a lifetime to be born. In fact, the idea of building it has been with me since I was 11 years old, but it had to wait until I retired and until I had enough means and the freedom and the time to be able to build it. I started building it in 1997 after I retired. It took 4 years to build, and it opened in March 2002. Originally intended to be a small, normal maternity facility. It remained. We have our firstborn 10 hours after we opened. Less than 24 hours later, we have our first male patient. Not pregnant, but a person who had a medical situation that we could help. In fact, it was an old man who was knocked down by a donkey cart just outside of the hospital on the road. And he was brought in unconscious, a little dazed, bleeding from the cut in his forehead. And we stopped the bleeding and sutured and dressed him, but we didn't know who he was, and we didn't know where he was coming from. We didn't know his name. And we kept him overnight until somebody came and collected him. And then of course, we have a few basic equipment. We have oxygen, we have sutures, we have whatever. And we kept having people coming in with asthma, coming in with diabetic, in a hypoglycemic diabetic problem. So you try to save one life, and then another, and a third, and a fourth. And then you come to a situation when you keep saying, yeah, but we are not a medical hospital, we are a maternity hospital. And you repeat that, and you say, well, what's stopping me from trying to save this person? So we dedicated a small room, a small ward to these unforeseen, unexpected, unplanned patients who were coming to us. That number grew. So now we have an entire department that takes care of medical conditions, surgical conditions, children who are sick, road accidents, injuries, bullet wounds, snake bites, malaria, landmine victims. We just have them. We are also a training hospital. We started the first training of nurses and midwives in Somaliland, and started that training well before the hospital was open. Today we have trained hundreds of nurses and midwives. Many of our graduates are now training other nurses and other midwives. Many of them are teaching in other institutions. Some are teaching in universities. Some are working with international organizations, WHO, UNICEF. Many big organizations have employees who are nurses and midwives who were trained by us in the past. In the past 8.5 years that we've been opened, we've delivered over 10,000 babies. The majority of them, over 1,000 of them, were born through a cesarean section. A good number of them had treatments that the pregnant mother and the child in her needed to control eclampsia. There's a seasonal outbreak of high blood pressure in pregnant women, toxemia of pregnancy or eclampsia, pre-eclampsia, a situation that no longer kills in your country, but is the biggest killer in my country. We have women who are brought to us from 4 days, 5 days journey with a placenta still inside them 5 days after the baby was born. Women who we never understand how they manage to reach us still alive. Some die at our doorstep. Some die a short while after admission. But many of them could have been saved if they had been brought to us 2 days, 3 days, 4 days prior to that. Many of them could have been saved if they had had prenatal care during their pregnancy. Many of them could have been saved if the person who had tried to deliver them had some knowledge of midwifery and obstetrics. We have patients admitted with situations that sometimes we're a breech. I know it's gruesome, but somebody's delivering a breech. They pull on the body, the body is delivered, the head is still inside the mother. And it's the most difficult decision do we do a C-section to go in and get the head out? Do we try to deliver it through the normal birth canal where the cervix has closed because that head had been in there for a couple of days? Situations that really are too gruesome for me to describe. But we are overwhelmed by what needs to be done. And unless we can spread the knowledge of midwifery throughout the country, we will continue to have situations like that happening. Some of traditional practices are very dangerous. We have the practice of female genital cutting that obstructs, that scars the passage that that child should have been born through. It adds to the complications that women have. So the hospital is just a small drop in the ocean of problems that have to be taken, that have to be addressed. Knowledge is the biggest gift, helping us to find trainers to help us train people in how to take care of themselves. I think this is the most valuable gift that anybody can leave with anybody else. It's the gift of knowledge that was given to me when I was training as a nurse and a midwife that is helping me today at 73 years old to help women. I've lost many things in my life. I've broken many things in my life. But that knowledge has remained with me, and I have been able to build on it and improve on it and pass it on to generations.